was that they were young, they were women, and they were brilliant. It's been a while since I've sat through an academic presentation, so this was quite stimulating for me to participate in. I noticed that the presenters were all ladies, at least the ones that I heard, and the questioners were all men. I don't know how that has any reference on mental health and your profession. I consider mental health, and especially your aspect of it, the work of the psychiatrist, as probably the most important job to be done in the profession. And so congratulations to all of you who have undertaken to function and operate in this aspect of healthcare delivery. I know that you seem to be an ignored sector in healthcare. For whatever reason, I don't know, we seem to stigmatize mental health, and yet the core of our personality as human beings is mental health. If your heart is working well and your head is not working well, your quality of life will be totally reduced. The whole concept of pursuit of happiness and being a happy person, a person who is in harmony with themselves, is related to our mental well-being. So for all of you who have undertaken this task to go to school and to study medicine and to choose psychiatric as your specialization, congratulations to all of you. Thank you so much. We need you tremendously, and I took notice of the part of the presentation that was made, I think, by the second presenter about the paucity of research that is related to our space, especially for those of us in the part of the world that is described as the third world, and particularly to a nation like Ghana and its allied countries in the ECOWAS region. It would seem as if very little research has been done, and I took note of the intervention of one of the speakers who said that we must fund our own research internally. And I think that is the way to go. In the end, I think that we drive what is important, and we drive what must move. My general feeling is that in our part of the world, we depend so much on government to solve all our problems. And so when the government has little interest in any aspect of our lives, that aspect of our life suffers tremendously. But it will be an abdication of personal responsibility for us to just leave the state to determine what is important to us. And that is why non-state actors are important in providing help in this area. And in this regard, churches play a major role. A few years ago, our church considered mental health. We are involved generally in two areas as a church. We're involved in education and we are involved in healthcare. and we try to function in the underserved areas in these operations. So when it comes to healthcare, we try to look at areas where attention is not directed at least from the state level. And when we considered healthcare, that's what we're looking at. And so for the last 3 years, we have been working with your association and with the good Dr. Ose here, who has helped to focus our intervention. And that is why the lady who introduced said that in Kumasi, our branch church there, one of the branches is involved, because it's become almost a policy in the church for us to look at mental health and support it wherever we are. Of course, that will not solve all the many problems we have, but we solve problems one step at a time. In addition to that, I think that we want to see some of you really venture and do big things for yourselves in your own unit. I appreciate that we have Pantan and we have Ankafo and we have the psychiatric hospital here. But you know, I am a private sector person. I appreciate what government does, but it means very little to me. What to me changes society is not what government does, it's what private people do. And it's when private people venture out and take initiative that society changes. Because government invariably does things, unfortunately, for votes. And so they will determine which knob, when pressed, will elicit the highest numbers. And so when your knob does not elicit high numbers, you will be left behind. And nobody would think about you. And because mental health is very much on the periphery of our social life, I mean, more or less, even traditionally, when somebody suffers mentally, we just ostracize them, take them somewhere else, remove them, and pretend that they don't exist. So it's not emotive enough for a person who is driven by numbers. And so, in addition to what the state has built, it would be great to have 2 or 3 of you band together to build institutions for mental health and serve people. And I think you do a far better job than what the state is doing. I am very worried that the state employs over 80% of all our healthcare providers, from doctors to nurses to pharmacists to physician assistants to lab technicians. Almost more than 80, probably about 90% of them are state employees. I think if we look through this number here, probably those statistics will hold true here, where about 80 to 90% of the people here may be employed by the state. And it's great, but state employment hasn't changed society much. It's private employment, it's private effort. It's when individuals build things that things change. If an individual owned a hospital like Kolebu, it would definitely be run better than the way Kolebu is run now. If an individual owned a facility like Ankafo or Panta or the Accra Psychiatric Hospital, it would be run better than it is being run. So it has been shown that private effort invariably has a higher motivation for success.
The founder and general overseer of the International Central Gospel Church.
Thank you very much.
There is a plaque that goes with it, and it reads, Psychiatric Association of Ghana honors you, Pastor Mensah Otabil, for your support of mental health in Ghana.
Well, thank you very much. My last daughter will be very free, is in mental health delivery. She toyed with becoming a psychiatrist, but got scared along the way. So she chose a less frightening option of a clinical psychologist. So I think she'll be thrilled that I'm close to her now. Thank you very much. I appreciate it very much.